Now we're going to try to transition to a cultural competency and education for immune-related adverse events management with immunotherapy. Massey, how do you know, what do you know about immunotherapy-related adverse events in different populations?
Thank you, Lisa. I think this is another challenging question. Cultural competency, we do live in a world that people travel, people migrate, and they start a new life in another country, but they do not come alone without their package of cultural, behavioral attitude and beliefs or religious practices or anything else. And I think that we, not only here in Canada, you also in the United States, are experiencing that too, because looking at different literature, again, if you, there was a publication in American Journal of Clinical Oncology by Perick in 2021 that patients in underserved group like Hispanic or African American were more likely to go to emergency room department or being admitted to be treated as an inpatient just because of immune-related adverse events. So again, you can see the health disparities, another confirmation that it does exist. In another article in the Journal of Academic Dermatology, the cutaneous immune-related adverse events was like non-white patients were half as likely to be diagnosed with this cutaneous irAE than white patients. We need to know that dermatological or cutaneous toxicities really is something very specialized, and only oncologists may not be able to treat these patients. Yeah, if you are having like a grade 1 rash, that might not need, but we know that this cutaneous toxicity sometimes will get really worse if we do not have an expert dermatologist to be involved on that. Not only that, if we do not have a proper education and training and make our patients to be their own advocate to report that. So again, that goes back to the culture. So it is really important to be culturally competent when we are talking to our patients about from different cultural background, when it gets to educating them about immune-related adverse events. Another example that it comes to my mind is having a patient that was not reporting. The treatment was working because their symptoms were getting much better. So they knew that the treatment is working, but of course they did have side effects. And just to stay on the treatment, they just did not report their cutaneous toxicity. Actually, they developed some kind of hand-foot syndrome, and they were not even able to walk to clinic. The husband brought the wife on wheelchair. And then when we did the thorough examination, we saw this terrible skin peeling off the feet. But the patient said, I'm fine, I can live with that, but I just need to continue the treatment. So you can see there may be some cultural beliefs, there may be some other issues in their thoughts or biases that they may have, or a lack of education or training. So all of these, although we know the treatment is working, but we can see that while they are not reporting that at the right time, we may not be able to continue the treatment. So immune-related adverse event management, considering patients' cultural background, is a key here to make sure that everybody will get the right treatment for their adverse events at the right time.
Thank you, Massey. And I can definitely relate to that. And you're absolutely right. When the patients know that the treatments are working, they don't want to interrupt the therapy by not reporting the side effects. And if you don't report the side effect can get worse, and they would have to be admitted to the hospital, and definitely um, delay treatment longer than they needed to be.